Welcome to the deep dive. We've pulled together a stack of source material here to really unpack a complex topic in veterinary medicine, nasal squamous cell carcinoma as it affects dogs and cats.
It's a difficult diagnosis, absolutely. And our mission in this deep dive is to guide you through what these sources tell us. We're going to look at exactly what this cancer is, how it behaves in these animals, the journey of diagnosis, and what the treatment options and likely prognosis look like based on the research and clinical info we have.
And as we dive in, you'll see this particular cancer has some characteristics that might surprise you, especially regarding where it focuses its energy, so to speak, and the challenges that presents.
hmm
Okay, so right off the bat, what exactly are we talking about? What is nasal squamous cell carcinoma in a dog or a cat?
Essentially, the sources describe it as a local invasion of cancerous squamous epithelium. This tissue originates from the lining of the nasal cavity itself and often extends into the connected air spaces, the paranasal sinuses, like the frontal or maxillary sinuses.
So it starts right there inside the nose or those adjacent cavities.
Precisely. And the material indicates it's typically a slowly progressive tumor, often developing over months. It commonly grows to affect both sides of the nasal passages as it advances.
Now, you hinted earlier that its behavior is a bit surprising. What stands out about how it spreads, or maybe doesn't spread, based on these sources?
There's a really critical point emphasized across the sources. At the time of diagnosis, this cancer often has a remarkably low metastatic rate.
Really?
Yeah. That means it's less likely, early on, to have spread to distant organs compared to many other cancers. The primary challenge isn't distant metastasis initially, it's something else entirely.
That's fascinating. Most people probably associate aggressive cancer with rapid spread everywhere. So how common is this specific type of cancer among all the nasal tumors pets can get?
Well, the research we looked at suggests it accounts for a significant percentage. About 15% to 17% of all nasal neoplasia seen in both dogs and cats.
Interesting. And who is typically affected? Are there certain types of dogs or cats that seem more prone to getting this?
The data shows it's more frequently diagnosed in dogs than in cats. For dogs, the median age is typically around 9 to 10 years, though it's seen across a wide age range, from 3 up to 16. There's also a male predilection mentioned.
Okay.
And specifically for the tumors arising in the sinuses as well as the nasal cavity, medium and large breeds appear to have a higher risk.
And cats. Similar age range.
Yes, median age in cats is quite similar, around 8 to 10 years, and the sources also note a male predilection there too.
This raises an important question. Do the sources shed any light on why this happens? What are the known or suspected causes and risk factors?
What's intriguing here is that the exact cause for intranasal SCC is largely unknown. The material we reviewed points to several factors that are, well, speculated to play a role rather than definitive causes.
Like,
For dogs, long-nosed breeds, the dolichocephalic breeds, are mentioned as a potential risk factor. Environmental factors feature prominently. Urban environments and exposure to tobacco smoke, meaning secondhand smoke, are both suggested.
so things in the air they breathe.
Exactly. Chronic irritants and other combustion products, think things like emissions from kerosene heaters or general urban pollution, are listed as possibilities. The research also suggests that chronic inflammation, like long-standing rhinitis or sinusitis, might somehow contribute to the development of this cancer over time.
Okay, so environmental exposures and potentially pre-existing irritation inside the nose. Is that where the UV link comes in? I think I saw that mentioned.
Good point. The sources are careful to make a distinction here. UV radiation is a strong risk factor, but specifically for SCC that occurs on the nasal planum.
Ah, the tip of the nose.
Right, that hairless tip, and it's particularly seen in white or lightly pigmented cats who get a lot of sun exposure. That type of SCC, on the outside, often have a much better prognosis with surgery. But the tumors we're focusing on mostly start inside the nasal cavity, where UV isn't really the primary suspect.
Got it. That's a really important distinction. So for the type that starts inside, what might someone actually see in their pet? What are the common clinical signs?
This is often where the diagnostic challenge lies. The early signs can be quite nonspecific, easily mistaken for common issues like infections or allergies, which unfortunately can delay recognizing something serious is going on.
Like just a routine runny nose, maybe.
Yes, nasal discharge is indeed the most frequent sign reported in the sources. It might start on one side, then become bilateral as the tumor grows. The discharge can vary thin and clear, that's serious, or thick and mucus-like, mucoid or mucopurulent.
Okay.
But a critical sign to watch for is epistaxis, or bloody nasal discharge. That can be intermittent or persistent and is a major red flag mentioned in the material.
Okay, so any blood in the nasal discharge needs serious attention.
Absolutely. Frequent sneezing, sometimes in these sort of paroxysmal fits, potentially with blood-tinged discharge, is also very common. As the tumor takes up space, you might hear stertorous or noisy breathing because the nasal passages are getting obstructed.
And does it ever show on the outside of the face?
Yes, if the tumor becomes advanced, facial deformity or swelling can occur, often right over the bridge of the nose.
Hmm.
This is a sign of the tumor actively invading and destroying the underlying bone and soft tissue.
Mm-hmm.
Ocular signs can also develop if the tumor extends into the eye socket, things like discharge, a bulging eye, that's exophthalmos, difficulty pushing the eye back in gently, an elevated third eyelid, or even pain around the eye.
That sounds incredibly uncomfortable.
It definitely can be. Pain is noted, with animals sometimes pawing at their face or becoming head shy, reluctant to be touched there. Other less specific signs like bad breath, halitosis, loss of appetite, weight loss, lethargy, or depression can also be seen, especially with chronic discomfort or if the animal has trouble eating due to facial pain.
And I know the sources mention a very concerning possibility in advanced cases, invasion near the brain.
Yes, exactly. If the tumor arose through the cribriform plate, that's a very thin bone, separating the nasal cavity from the brain, it can invade the brain itself. This can lead to neurological signs. The sources point out that seizures are seen in up to 35% of affected dogs in these advanced stages, along with behavioral changes or other neurological deficits. That level of invasion signifies a very serious late stage of the disease.
Wow. So, given these signs can mimic other problems initially, how do vets definitively figure out if this is nasal SCC?
The absolute requirement for a definitive diagnosis, stressed repeatedly in the sources, is a tissue biopsy.
Hmm.
You need to get a physical sample of the mass and have a veterinary pathologist confirm the cell type.
And before you even get to a biopsy, there must be a whole list of other things it could be, right? The differentials.
Oh, completely. The list of differential diagnoses is extensive. It includes other types of nasal tumors, like adenocarcinoma, which is actually more common than SCC in dogs, or lymphoma, which is a significant consideration in cats.
Okay.
Fungal infections, such as aspergillosis in dogs or cryptococcosis in cats, can present very similarly. We also have to consider inflammatory polyps, more common in cats, foreign bodies stuck in the nose, or even severe dental disease, where infection or inflammation is spread up into the nasal cavity or sinuses.
Right, so ruling out those other possibilities is key. What about routine tests? Blood work, urinalysis, do they help much?
Routine blood tests and urinalysis are typically normal with nasal SCC. The sources note that anemia could develop if there's been chronic severe epistaxis causing significant blood loss. And if there is severe bleeding, checking a coagulation profile and blood pressure is a wise step before attempting a biopsy, just to minimize risks.
And imaging. This seems like the area where you really get a look at what's going on internally.
Imaging is absolutely crucial, perhaps the most important diagnostic step after suspecting a nasal issue. Skull radiographs, basic x-rays, can show some clues like asymmetry, signs of bone destruction, or soft tissue density,
Yeah.
but they're limited in detail.
Not quite enough.
Often not. Thoracic radiographs, chest x-rays are always needed to check for metastasis to the lungs, although as we mentioned, this is uncommon at the initial diagnosis.
So what's the best way to image this area then?
According to the material, CT, or computed tomography, and MRI, magnetic resonance imaging, are considered the gold standard imaging modalities for staging and diagnosis.
CT is exceptional for visualizing bony destruction and precisely defining the extent of the tumor within the nasal cavity and sinuses. MRI is superior for soft tissue detail and is essential for determining if there's invasion into the brain. These images are vital not just for diagnosis, but also for planning treatment, especially something like radiation therapy.
Okay, so advanced imaging gives you the roadmap. How do you physically get that tissue sample for the biopsy?
There are several approaches outlined. Rhinoscopy-guided biopsy is common. That's using a flexible or rigid endoscope passed into the nasal passage to visualize the mass and take a targeted sample.
Right.
Other methods include blind nasal biopsy, where you sample based on imaging location, but without direct visualization, this carries a higher risk of bleeding, so it's done carefully. There's also surgical biopsy if the tumor is accessible, or sometimes accessing a mass related to tooth roots via a dental extraction site.
Mm-hmm.
The sources strongly caution about minimizing the risk of penetrating that thin cribriform plate into the brain during sampling, whatever method is used.
And checking the local spread, lymph nodes. Yes, absolutely. Cytology or biopsy of the regional lymph nodes, specifically the mandibular nodes under the jaw, and the retropharyngeal nodes further back in the throat area should be performed. The sources indicate that metastasis to these local nodes is present in up to 10% of cases at the time of diagnosis.
Let's dig a bit deeper into the tumor's behavior. You emphasize the low distant metastasis early on. What is the defining biological characteristic of this cancer based on the sources?
Here's where the sources really highlight its true nature. The defining characteristic of nasal squamous cell carcinoma is its highly aggressive local invasion.
Okay.
This cancer isn't just growing, it's actively destroying surrounding tissues, bone, cartilage, soft tissues. It erodes the delicate turbinates inside the nose, invades the facial bones, can push into the eye socket, and, as we discussed, potentially breach that cribriform plate into the brain. This relentless local destruction is the primary cause of the severe clinical signs and the biggest hurdle for treatment.
So it's more of a wrecking ball in its immediate vicinity than a seed spreader to distant sites, at least initially.
That's a good way to put it for the early stages. While the distant metastatic potential is relatively low at diagnosis, the sources do point out that the rate can increase significantly later in the disease course, potentially approaching 40% to 50% at the time the animal passes away or is euthanized due to the disease. So while not often present early, it can become a factor over time.
And if it does spread later, where does it most commonly go?
The material shows the most frequent sites for this later metastasis are those regional lymph nodes we mentioned, and lungs.
Given that aggressive local behavior in such a difficult location, what can be done about it? What are the treatment options discussed in these sources?
Because of the aggressive local nature and the complex anatomy, a multimodal approach is often necessary.
Is surgery a good option for these internal tumors? Seems like it would be tough.
Exactly. The sources are quite clear that for intranasal or sinonasal SCC, the tumors starting inside the role of surgery is very limited. Due to the extensive invasion into bone and the intricate structures of the nose, achieving complete surgical removal is often impossible without causing unacceptable damage or disfigurement.
Right.
Surgery alone is generally not considered an effective long-term treatment for these internal tumors.
Okay, so cutting it out isn't the main strategy for the ones deep inside. Is there any scenario where surgery is effective for nasal SCC?
Yes, and this is that really important distinction that sources make. For SCC that is limited to the nasal planum, that external tip of the nose.
The sun-induced ones, often.
Often, yes, particularly in white cats. For those, surgical removal, a procedure called a nasal planectomy, removing the tip of the nose with wide margins can be curative. That specific external form of the disease has a much better prognosis with surgery than the internal form.
That makes a lot of sense. Much easier to get clean margins on the outside. So if surgery isn't the go-to for the internal tumors, what is?
Radiation therapy, RT, is considered the primary treatment modality and the standard of care for most intranasal and sinus SCCs. It's the most effective way, according to the material, to achieve local tumor control in this difficult anatomical area.
What does radiation therapy involve? What are the main types?
The sources describe two main types: definitive RT, which uses higher total doses given over many small daily fractions for several weeks. The goal here is long-term local control or potentially cure.
Okay.
Then there's palliative RT, which uses lower doses over fewer fractions, perhaps given weekly. The aim of palliative radiation is more to improve clinical signs and enhance quality of life, rather than necessarily achieving long-term tumor eradication.
Are there potential side effects with radiation in that area? It seems delicate.
Yes, there can be. Acute side effects happen during or shortly after treatment and are usually temporary, like inflammation of the mucous membranes, that's mucositis.
Right.
Late side effects can develop months or even years later and can be serious, including potential ocular problems like cataracts or dry eye, bone necrosis, or even brain necrosis if that area was in the radiation field. The sources mention advanced techniques like IMRT, SRS, or SRT, which stand for intensity modulated radiation therapy, stereotactic radiosurgery, and stereotactic radiation therapy. These use highly focused beams and advanced planning to try and deliver a high dose to the tumor while minimizing exposure to critical surrounding structures like the eyes, brain, and oral cavity, potentially reducing some late effects.
Okay, so radiation is key for local control. What about chemotherapy? Does that play a big role?
Chemotherapy is generally not highly effective as a standalone treatment for these tumors. Its main role, based on the sources, is as an adjuvant therapy, meaning used in addition to other treatments like radiation, particularly for documented metastasis or for high-grade tumors where the risk of metastasis is considered higher.
What are some of the drugs mentioned?
The sources list drugs like cisplatin, carboplatin, methoxytrone, mostly in dogs, and tauceranib phosphate, also in dogs. There's a very important caution highlighted about cisplatin. It is severely nephrotoxic and should never be used in cats.
Never in cats. Got it.
Absolutely critical. It's also nephrotoxic in dogs and requires very specific protocols with intravenous fluids, saline diuresis during administration to protect the kidneys.
Any other ways chemo might be used locally?
Yes, the sources mention techniques like intralesional cisplatin injection, where the drug is injected directly into the tumor, or electrochemotherapy. Electrochemotherapy uses electrical pulses to help cells absorb chemotherapy drugs more effectively. These methods might be used for local control if radiation isn't feasible or chosen, though they aren't typically the primary treatment.
And what about just managing the symptoms even if the tumor isn't cured? Palliative care?
Palliative care is absolutely crucial, especially for maintaining quality of life in advanced cases or when definitive treatment isn't pursued. This involves managing pain effectively, using antibiotics for secondary bacterial infections that often occur with obstructed nasal passages, appetite stimulants, and ensuring adequate nutrition. The sources even anecdotally mention nasal hydropulsion, essentially flushing the nasal passages under sedation to help clear discharge and debris for symptom relief.
Putting all that together, what does the prognosis typically look like for an animal diagnosed with nasal squamous cell carcinoma? It sounds challenging.
Unfortunately, based on the source material, the prognosis is generally considered guarded to poor. Again, this is primarily due to that aggressive local invasion and the inherent difficulty of treating tumors effectively in such a complex anatomical location like the nasal cavity.
What kind of survival times do the sources report? Can treatment help?
For untreated nasal tumors of any type, the median survival is unfortunately quite short, often only around 2 to 6 months, and the sources suggest it's even shorter if significant epistaxis is present at diagnosis.
Wow, very short.
Yes, but with definitive radiation therapy, the survival times improve significantly. Median survival times range from roughly 6 to 18 months in dogs, and, depending on the study, sometimes up to 12 to 36 months in cats. One source specifically noted 2-year survival rates in dogs of 30–48% and a 1-year survival of 44% in cats receiving definitive RT.
And with palliative radiation, does that extend life much?
Palliative RT is quite effective at improving clinical signs in about 90% of dogs and typically results in median survival times around 4.8 to 12 months. So, better than no treatment and good for quality of life, but not usually as long as definitive RT. The sources do mention one study where aggressive surgery combined with radiation in dogs saw survivals up to 4 years, but those more common outcomes with RT alone fall into those earlier ranges we discussed.
What factors seem to predict a worse outcome?
The stage of the tumor is a major factor. Advanced local invasion, like invasion into the cribriform plate affecting the brain, noticeable facial deformity, or involvement of the eye socket, is generally associated with a poorer prognosis. The presence of significant epistaxis at diagnosis is also mentioned as potentially meaning a shorter survival time. And local recurrence after treatment, especially if it extends towards or into the brain, is unfortunately common and is a poor prognostic sign.
Does the SCC cell type itself mean it's automatically worse than, say, an adenocarcinoma?
It's interesting, the source material notes some conflicting findings on that. Some research suggests adenocarcinomas might have a slightly better prognosis, while undifferentiated carcinomas could be worse, and maybe some sarcomas like chondrosarcoma potentially better than SCC. But other studies don't find a significant difference based purely on the cell type once the tumor is established in this location. It seems the behavior, that aggressive local invasion, might be the dominant factor overriding subtle cell type differences for many cases here.
Right, the location and invasion pattern are just so critical. Once treatment has been completed, what does monitoring and follow-up typically involve?
Monitoring is important. Initially, you're watching for any acute or late side effects from radiation therapy, if that was part of the plan. Regular recheck exams are recommended, typically every 1 to 3 months. This includes a thorough physical exam and careful palpation of those regional lymph nodes in the head and neck area to check for any signs of local spread or recurrence.
And imaging post-treatment, more CT scans.
Periodic imaging is usually recommended. This includes thoracic radiographs, chest x-rays to screen for distant metastasis to the lungs. And yes, repeat CT scans might be necessary to monitor the original site for local recurrence or progression within the nasal cavity and sinuses. The sources also note that chronic rhinitis, just ongoing inflammation and discharge, can sometimes persist even after successful treatment of the tumor itself and may require long-term management.
And given the complexity of this disease and its treatment, referrals seem key.
The sources strongly recommend referral to a board-certified veterinary oncologist or radiation oncologist. Their expertise is really invaluable for guiding the diagnostic workup, developing the most appropriate treatment plan, administering therapies like radiation safely and effectively, and managing the follow-up for such a challenging condition.
So, taking a step back from all the details, the core takeaway from these sources seems to be that nasal squamous cell carcinoma is a formidable opponent primarily because of its incredibly aggressive local behavior in a really difficult, anatomically complex location.
Absolutely. While early distance spread isn't the main defining feature, that relentless local destructiveness is the challenge that impacts quality of life and makes achieving complete control so difficult. Radiation therapy stands out in the material as the treatment offering the best chance for managing that local tumor growth and significantly improving survival times compared to no treatment.
And for anyone concerned about nasal signs in their pet, understanding those key warning signs, especially the presence of bloody discharge, and recognizing the absolute importance of advanced imaging like CT or MRI to truly see what's going on inside seems critical for getting an accurate diagnosis early. That then opens the door to potential treatment options.
Exactly. Knowledge of those signs and the value of advanced diagnostics are the crucial first steps in navigating this difficult disease.
This deep dive into the source material has been incredibly informative about a difficult condition. As we wrap up, here's a thought to consider. Given the strong speculation in the sources about environmental factors like urban pollution and tobacco smoke potentially playing a role, how much of this disease might be linked to environmental exposures that we could theoretically minimize? Does understanding those potential links offer any avenues, even small ones, for prevention or for thinking about broader animal health in polluted environments?
That's a great point. And perhaps on the biological side, the way this specific cancer is so focused on aggressive local invasion rather than rapid distance spread early on, that's quite a distinct behavior, isn't it? What does that particular pattern of growth and spread tell us fundamentally about the biology of this type of tumor? Perhaps it points towards unique vulnerabilities or driving forces that differ from cancers defined by widespread metastasis. It's a unique characteristic worth contemplating.
Really interesting questions to ponder. Thank you for joining us for this deep dive into these sources.